But you've said men and women
Yes.
are in this together, and
Absolutely.
men have the bigger percentage of the problem.
Yes.
How do you ascertain? What test do you do then and say, now, you have a problem?
For men, it's very simple. We just need a semen sample. They need to come and they need to give a semen sample. How do you do it? Very simple as well, even though most men say, no, this is an African, we don't do it, etc. And that is by masturbation. So they come, they need to avoid having sex for 3 to 5 days, and then they come to the lab. They're given call it a pot or a container. They're given a private room where they go and they give that sample. Now, in that sample, we need to see some parameters. And these parameters are, number one, for example, we need to see, first of all, we look at how long did it take from the time of ejaculation until the time of, examining this sample. Very important because there's something called liquefaction time, the time from when the sample is given to the time when it is watery. That is when we can actually start assessing it. So once we have measured that, we want to see how much of that ejaculate is. And we want 1.5 milliliters or more. 1.5 milliliters is about half a spoonful. All right. Now, in that ejaculate, we look at the pH. The pH should be between 7.2 and 8. Remember, the vaginal pH is very acidic, and the male pH is very basic. So when we put them together, actually, when you have intercourse, there's neutralization. This helps actually the sperms to swim and to get to where they're supposed to get. We look at what is called agglutination, that is the clumping together of sperm. Sometimes it can be there, but ideally it's not supposed to be there. And there can be different types of clumping. Remember, a normal sperm has a head and has what you call a neck piece and a tail. That tail is what actually makes that sperm swim to get to the object, and that object is basically the egg. So we want to see whether there's any clumping, and the clumping can be head to head, where the heads meet, or it can be head to tail, or sometimes tail to tail. Then we want to look at the motility, how these sperms swim. There are different types of motility. Kuna what we call type A. These are the ones which swim very fast. Let me call them the sprinters. The Omanyalas.
Yes.
And the Bolts. And then there is type B. They also swim fast, but not as fast as the sprinters. Let's call them the Kenyans, the long distance runners.
Yes.
Sawa sawa, Kina Kipchoge and other people.
Yes.
So we put the sprinters and the long distance runners together. That is type A and type B. And we are supposed to get about 40% of that. Now, there is type C, which swims in one place, but they don't go anywhere. Those ones, we don't count them. And then there is type D, which are immotile. They're not moving at all. Then we go now to the numbers. How many sperms are in that ejaculate in 1 milliliter, what we call the concentration. We want the concentration to be 15 million or more. And then now, out of that, we want now to see in the whole ejaculate, let's say the ejaculate was 3 milliliters. And in the concentration, there were, let's say, 20 million. So the total count will be 60 million. So 20 million times 3 gives us 60 million. We normally want 40 million or more. Then apart from that, out of these 60 million, we want to see how many of them are normal. Unfortunately, the majority of the sperm is usually abnormal. But if we get 4% or more, then it is okay. Now, we also don't want to see red blood cells in the ejaculate. And also, we don't want to see pus cells, because that would mean that the ejaculate, there's some infection in the sperm, and so on. So we put all these things together, and then we can tell the patient, this test that you did, it is okay. Or if there are issues with the swimming, we call that asthenospermia, meaning that the sperms are not swimming the way they are, the percentage of sperms are not swimming the way they are supposed to. If the numbers are fewer than what they are supposed to be, we call that oligospermia. If the normal forms are not where they are supposed to be, we call that teratospermia.
All right.
Now, there is an issue that is called azoospermia. That means that a man gives a sample, but there are no sperms at all in it. That's a different, cup of tea, as it were. But this we can ascertain from that ejaculate that a man gives us.
So that is for men.
That is for men.
It sounds like a complicated test. Is it the same for women?
The women is even more complicated. Women are usually more complicated than men.
Okay.
Now, for women, first of all, we need to get this couple. It's usually good when they come together, the man and the woman.
Okay.
But most of the time, you find the ladies come and they say, mzee alisema, wewe enda kwanza upimwe alafu nilete report. But usually it is good when they would come together. Yes. We talk to the lady, we talk to the man, we try and understand what the problem is. We take a medical history. When was her first period? How are the periods? Are they regular? Are they heavy? Are they painful? Are they clotty? And so on and so forth. Whether they have any allergies, whether she has any medical issues, high blood pressure, diabetes, etc., etc. We take all this. And we also want to know the family history as well. Whether in the family there is high blood pressure, there is diabetes, whether there are any cancers, and so on. So once we have all this is when now we can send her for some tests. And the tests that we want to do for the ladies are basically 2 or 3 of them, which are very basic. The first one is we want to find out about the tubes. Remember from our 4th form biology that the eggs have to pass through the tube. If we say my hand is a tube, then we want to see whether that tube is okay. And how do we do that? We send her to an imaging center where they do what is called HSG, which is hysterosalpingogram, sort of a mouthful. It can be a bit uncomfortable test, but that is the gold standard for checking for tubal patency, whether they are okay. And we inject what we call a contrast, which is supposed to go through the womb and spill out through the tubes and into the pelvis. As we are doing that, we take X-ray pictures. So later on, we'll get a film and we'll look at it, we'll analyze, we'll see the tubes are okay, or the tubes are blocked, and if they are blocked, where are they blocked? Because they can be blocked at different levels, or whether there is fluid as well in the tube, and so on. We can also see in the womb whether there are other problems. Sometimes there can be what you call fibroids. You may have some growths in the cavity of the womb, and so on. So that is the first test that we want to do. The second test that we want to do is to send them for a blood test. And in the blood test, we want to check some very basic hormones. The way the body behaves, we have very many different hormones, and we want to look at specific hormones which are responsible for, number 1, to look at what we call the ovarian reserve. Number 2, we want to look at what is called the thyroid gland, what is called thyroid stimulating hormone, and what is called prolactin. And then lastly, we want to do a scan. And the scan that we want to do is basically a transvaginal scan, that is through the vagina. We want to look at the ovaries and we want to look at the womb itself. What are we looking at in the ovaries? We are looking at what is called follicles to see how many they are. That now, together with the blood test that we did, will actually give us a very good idea about the fertility of this lady. And again, in the scan itself, we'll also be looking at what we call the endometrium, or the lining of the womb, and this is where generally the baby implants and grows. So if there's a problem, we can actually see it right at the beginning, and then now we can formulate a plan together with that semen analysis that we did in the beginning. So we put them together, then we say, look, the sperm has an issue. What is the issue? This is what we can do about it. On the female side, hormones are okay, or if there's an issue with the hormones, this is what we can do. Or if the ovaries have an issue or the womb has an issue, then this is what we can do so that we can be able to help this couple.
All right.